Good day, everyone, and welcome to our CGHI Interview Series. Today we have a special guest, Mutile Mwongo, our CGHI Community Team Lead. Hello, Mutile.
Hi, Shakeen, and hi, Nicole.
Hello. For those who may be new to us, the Coalition for Global Health Innovation is a global youth-led nonprofit bringing together a diverse multidisciplinary community for young professionals and emerging leaders from across 6 continents. Our mission is to empowering our members to transform innovative ideas into actionable projects, advancing equity and inclusion in global health. This series of our way is our way of introducing the individuals behind CGHI. Through these conversations, we aim to share their stories, the lessons they've learned, and the motivation that drive them on their global health journey. It's a chance to spotlight the people who make our community what it is: passionate, diverse, and committed to impact. To briefly introduce myself, I'm Shikin, social media manager at CGHI. I study digital media in Beijing and creative and cultural industry in Sheffield, and also explored photography in Argentina. And today I'm joining the interview from Lima, Peru. Nicole, would you like to introduce yourself?
Of course. Hi, I'm Nicole. I'm co-host of the CGHI Interview Series with a background in sociology and public health. Joining today from Washington, D.C. Today, we're thrilled to speak with Mutile Mwongo, a microbiologist and biotechnologist whose work sits at the intersection of climate change and public health. With a strong foundation in biology and a deep commitment to systems thinking and youth engagement, she brings both scientific insights and community-centered leadership to everything she does, including in her role as co-lead of the CGHI Action Tank program. We're looking forward to exploring her journey into global health, what motivates her work, and how she envisions the role of young professionals in shaping a healthier, more equitable future. Mutile, let's start with your journey. Would you like to introduce yourself further and talk about your academic background and what led you into the global health space?
Sure. Um, Again, just thank you, Nicole and Shakeen, for inviting me to this interview. Such a pleasure to talk to you and tell you a little bit about what I've done with CGHI and my journey in global health. So my name is Mutile Mwongo. I am from Nairobi in Kenya, born and raised. And just to talk a little bit about my journey, my academic journey, I started out in primary school as someone who really loved science. And so at that level, that was things like learning about plants, learning about animals, and that kind of thing. They're very simple things. When I went to high school, I really started thinking about how biology seemed quite interesting to me. And luckily, I was also pretty good at it. And I think that's what led me to choose microbiology and biotechnology for my undergrad in university. And so that's why I started to focus on these really tiny creatures. I thought it was fascinating what they're able to do. It was fascinating to understand how these microorganisms interact with each other, with the environment, with humans, plants, and animals, and how they are both beneficial and harmful at the same time. And so I remember some of my favorite classes in undergrad were around pathogens, so things like pathogenesis, things related to immunity. And it was really interesting how microorganisms interact with humans. And so that understanding, I think, is what led me to think about interconnections, and what eventually led me to think about global health, because I was learning about things like malaria and the parasites that cause them, things like neglected tropical diseases, which only occur in some countries of the world at this point in time. And I think that's basically how my journey into global health looked like. Right now, uh, very interested in the larger system around global health, and the details at the same time of how these interesting diseases emerge. So thinking about things like the social and economic determinants of health are things that I'm really curious about.
Thank you, Mutile, for sharing your journey, and your work sits at the complex interconnection of health, climate, and systems changes. Was there a formative experience, like academic or professional or personal, that led you into this path?
I think when it comes to my journey now, particularly into systems thinking and the intersection of health and climate change, that happened around COVID. It's kind of cliche, but I remember how in the news there were stories about how animals are returning to occupy public spaces that were previously kind of encroached on by humans. The air quality was better and things like those. And so at that point, I didn't do much research into what were the causes, what were the interactions, but I really started thinking about how human activities affect nature and the climate, and how that kind of comes back to affect us. So once I learned about the intersection of climate change and health, my perspective was opened up way more to this worldview of interconnectedness and intersections and complexity.
Mm. How has having that interdisciplinary lens and interconnectedness framework, how has that shaped how you approach challenges when it comes to public health and climate?
I think it basically means that every problem has multiple causes, possible causes. And so we are not isolating problems anymore. We are not looking at them as an individual. We are looking at them as something that has been caused by different things that interact. And these interactions combine with each other, and then there's like a cascading effect, or there's a ripple effect. And so these various interconnections and interactions are now how I look at single public health problems. So it's kind of just understanding that at this point in time, particularly in the current global context, it's really difficult to think that there's a linear way or a reductionist way that will help to solve a single problem. So basically, this approach has helped me to figure out not only the understanding of the problem, but even the possible fixes or interventions to them.
Thank you for sharing. That's a really thoughtful way to approach the complexity. And the system work often means dealing with the complexity and uncertainty. And what one challenge you've encountered while working in this space, and how did you approach it?
I would say that working with complexity and uncertainty can be pretty uncomfortable, because we're often dealing with things that seem out of our realm of understanding. And it seems like there are more questions than answers. And that has been a difficult mindset to embrace and embody, not only in my work, but even just in my person, like just as a human being. I don't think we are very accustomed or socialized to live well with uncertainty, because we like to know what's the next step, what's happening now. But I think systems thinking has helped me to just come to terms with the fact that things will not always be certain, and that's okay. And so it takes a really active reframing of the mind to get comfortable with that. At the same time, it's also quite interesting to deal with your own assumptions and mindsets, and mental models when you're thinking about public health or social challenges. So as someone working in systems, we often work outside of ourselves. So we take an external challenge, we try to dig down to the root cause of it, But slowly I've kind of just learned that humans are not neutral at all. We have our own experiences that influence how we see things and perceive problems in the first place. And so it's interesting to come to terms with that as well. Just knowing that we are not free of bias or influence, even as we try to do that kind of work.
That's very insightful to be aware of personal bias and a powerful mindset to be okay with uncertainty and discomfort. I want to now ask you about your work with CGHI and the Action Tank. Could you please tell us more about your role and what excites you, excuse me, about building community and supporting early career and young professionals?
Yeah, so at CGHI, I played the role of community lead. I've held this position for a bit over a year now, and it basically involves coordinating and planning around our events, things like online discussions, webinars, forums, anything like that. But at the core, I think it's largely about fostering connections, meaningful connections within our community, and even extending outwards to a wider audience, to other stakeholders, partners, and so on. And so in the Action Tank, what we do is we try to capacitate early career professionals in global health with skills around developing their projects. So we help them through a process where they think around the logic of their project, whether it's developing or just starting to think about a theory of change, some of the steps they would need to get involved in and activities for the project, stakeholders, preparing them for investment potentially, and things like those. And I think the reason this is interesting to me and important is because the potential of collectives is kind of something to behold. It's what excites me about community building. And at in the current state of the world, it's never been clearer that there is power in being together and in collective wisdom and collective sharing. And so that's essentially what we do in the Action Tank is we get together with groups of young professionals, we help them develop their ideas a bit further, and hopefully we get to a point where we're all able to see ourselves as collaborators rather than as competitors and build on each other's strengths.
That's really beautiful about the connection and also to make the idea into actions. And looking back on your work so far, is there a particular project or moment you're especially proud of that reflects your values or made a meaningful impact?
Yeah, so I'm currently working on a project with a really incredible group of partners where we're trying to reimagine the health research ecosystem. And so we're thinking about issues like how health research is extractive from community. It's also very exclusive. So there's a set of people who are set aside just to do research. And so each of the partners we're working with is thinking about new models of engagement in community and how to make health research more equitable, more inclusive, and responsive to different social and political contexts because the partners are in different countries. But at the same time, since I really am keen on community, the power of community, the power of networks, we're also thinking about how to do this together and how we learn together. And I think sometimes we forget that the process of work is learning itself and not always the end. And we're thinking very intentionally around that and how we can build those relationships based in trust, and just strengthen our community. So I guess the values here that I'm really keen on are things like trust, accountability, and coexisting within community, because I think that's where the power lies.
Absolutely. That sounds like it's very important work. And speaking of community, I want to ask you about for young professionals, what advice would you give to young professionals who are interested in doing global health or systems health work?
Right. I think the basic advice I would give is to stay curious. I think don't feel too confined by what you are studying currently or have studied. A lot of the fundamental concepts you learn in your undergrad or in the first years of your work, and those foundational skills often can be applied across fields, across sectors. So keep an open mind, and allow yourself to explore. So if there's something you're particularly interested in, try to expand how you look at it. Think about possible connections it has with other issues in the world. Even if it seems highly scientific, there's never a problem that exists on its own. So think about how it relates with the humanities, perhaps, and anything like that. But also don't hesitate to talk to other people who are working around that. They might be able to give you insight into the range of possibilities.
Well, thank you for sharing this advice, and I'm sure our audience gonna appreciate that. And speaking of advice, I would like to ask who has the greatest influence on your career, and what lasting lesson did they leave you with?
This is a tough one for me. Interestingly, I think that one of my high school teachers had a great influence on not my career per se, but how I do my work. And one of those teachers said that I'm good at writing. And that has kind of been a way that I express myself, not only professionally in my career, but also just personally. Um, and that encouragement from the teacher helped me to develop my skill in writing, which has been very important for the work I do, which is, it requires a lot of research and then synthesizing and putting things together and, getting some output from that in a document in some written form. Yeah, I think the encouragement we get from teachers has a really huge influence on what we do when we are a bit older.
And speaking of influence, is there a book or a film that stands out that has changed the way you think about social change or leadership?
More than how I think about leadership or social change, I think that books have taught me immensely about empathy. I think the potential of fictional stories to elicit emotions, to make you connect with the characters, to make you find resonance with the characters' journeys, and even conflict and feel upset at injustice in the stories is just beautiful and awe-inspiring. So, fictional stories for me have taught me about connecting and connections with people. And I think to myself, if I can feel that way about a fictional character, how much more then should I be able to feel for a fellow real quote unquote human being? And I guess that also trickles down into leadership. So thinking about how to lead with empathy and why social change is so important to me is because I care about other people.
Thank you so much for sharing, and this is so beautiful, and thank you for bringing such clarity and depth to this conversation. And your story beautifully illustrates how system thinking and scientific inquiry and grounded community work can converge in to drive transformative change in global health. Thank you, Mutile.
Thank you.
Yeah, thank you so much. It's you shared so much wisdom with us today. I know you've certainly inspired me, and I know you will inspire people watching. Just your approach from coming from thinking about small microorganisms to large, complex, uncertain systems in the world of global health and science and climate change. So thank you so much for your time and reminding us to stay curious and embody empathy and leadership in everything that we do.
Thank you for having me.
Of course.
Thank you.
All right.